Welcome to Workers' Compensation Challenges for the Mobile Workforce, Policy and Practice in Canadian Jurisdictions. We're glad you're joining us today for this webinar that is part of our ongoing series on health and the mobile workforce. My name is Yusra Benjeloun, Administrative Coordinator and Projects Manager with the Work Wellness and Disability Prevention Institute, and I'll be co-moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program, through the BC government, as well as donations and memberships to WWDPI. We thank our program partners, Canadian Council on Rehabilitation and Work, Education Advisory Committee, and speakers who contribute to this webinar series. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing and to ask any questions related to the presentation. We will collect questions submitted throughout the presentation and follow the presentation with the Q&A based on the questions submitted. Any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website within a week, along with the slides. You will be emailed the direct links for all of these items when they're available. Our webinar today is co-moderated by Dr. Barb Neese, Project Director of the On the Move Partnership at the Memorial University of Newfoundland. Dr. Neese will be moderating our Q&A session, and I will let her introduce our speakers, Dr. Katherine Lippel and Dana Hose.
Thanks very much, Yusra. Welcome everyone to the first in a series of 3 webinars co-sponsored by WWDPI and the On the Move Partnership. The On the Move Partnership is a national program of research on extended complex mobility for work in the Canadian context. Now in its 8th year, On the Move has been documenting diverse mobility patterns across multiple sectors, the drivers for these complex extended work-related mobility patterns, and the consequences of them for employers, workers, and their families, and home and host communities. A key part of On the Move has been a series of policy-related studies led by one of today's speakers, Professor Katherine Lippel, Canada Research Chair for Occupational Health and Safety Law at the University of Ottawa. On the Move's policy component has been examining policy drivers and gaps associated with different kinds of extended complex mobility for work, including those that relate to workers' compensation policy, our focus today, as well as occupational health and safety, employment standards, pensions, and other policy areas. On the Move includes in its scope attention to international migrant or temporary foreign workers who come to Canada to work on a temporary basis. So today's webinar focuses on the Move findings related to workers' compensation challenges for the mobile workforce. But it also draws on findings from a spin-off program of research focusing explicitly on some of the challenges related to return to work among mobile workers. Dr. Dana Hose, currently a postdoctoral fellow with the Centre for Research in Work Disability Policy, based at the Institute for Work and Health, and a team member in this second research program, will present some findings from that project. On June 10th, the second WWDPI On the Move webinar in the series will focus on health and wellness among temporary foreign workers, and on July 4th, Professor Lippel and I will return to present findings from On the Move's research on occupational health and safety in the mobile workforce. Katherine, over to you.
Thanks, Barb. So thank you, everybody, for coming to this webinar. I'm going to be talking for about half an hour on the regulatory aspects that we've been looking at over the last 7 years in the On the Move research. And what we've seen is that we've been working with a team that Barb has evoked as well, looking also at return to work specifically. So after having done several years with On the Move, we saw that it was important to also focus on return to work after work injury. And up on this slide, you will see the people who are speaking today, myself and Barb Neese and Dana Hose, as well as other members of our Partnership Development Grant. And we're pleased to say that this research has actually now been funded until 2023. So that we're both focusing on return to work in these presentations, but more broadly on also workers' compensation as such. And I must say that because we've expanded our research for the next 5 years, we're very interested in hearing from anybody online who perhaps would like to know more about this new research. So the outline for my presentation today, first of all, I'm going to give you a few ideas about the definition of geographically mobile workers, look at some methods that are underpinning my study and underpinning the data that was gathered and given to Dana. Then talk about the workers' compensation frameworks in Canada. I'm a lawyer by training, and so please bear with me while we do a bit of law in relation to this, because it's really the element that's essential to understand what's going on. And our research questions are looking at the challenges to regulatory effectiveness. So does workers' compensation law work? And we'll go across the spectrum of mobility. So you'll see in a minute the definition of that. And some of the issues that are cross-cutting for everybody are the commuting accidents and different challenges related to distance. And then we'll hone in particularly on interprovincial mobility, and then finally on international migrants. And then we have a couple of slides in conclusion. So the geographically mobile workforce, who are we talking about? You can have people who are commuting between clients on a daily basis, like home care workers, or people who are installing telephone systems or internet systems in homes. You can have short-term commutes, people who live around 3 hours a day of commuting to get back and forth to their workplace. So if you think, for instance, if you're in Toronto, somebody living in Brampton and taking public transport, as Stephanie Premji's work in our team has shown, that there's quite a long commute to actually get to your minimum wage job. And I imagine that in Vancouver, Port Coquitlam going into Vancouver is the same type of issue. Then you have a long commute within province, somebody who is driving up from Edmonton up to the tar sands, a long commute to another province, somebody flying from Newfoundland up to the tar sands. And then you have international commutes. And we often think, well, the temporary foreign workers are the ones who are engaged in international commuting, but it's just as true that Canadian workers working in another country temporarily are also engaged in international commuting. And our report and the research we've done over the last several years touches on all these people in relation to both workers' compensation and, as Barb said, occupational health and safety as well. On the right-hand side of your screen, you also have the question of double mobility. So people who work on mobile workplaces, be they ships, planes, trucks, buses, often have to travel long distances to actually get started. So you can live in Newfoundland and pick up your ship, as Desai Shan has shown in our team, pick up your ship in Montreal and have to fly to Montreal before you start working when you get on that ship. So these people are the people we refer to when we talk about double mobility as such. And of course, from a health and safety and workers' comp perspective, there are particular challenges that go with mobile workplaces. I guess should have warned you, there are poll questions in this presentation, and this is the first one. So I'll give you a minute to look at this question. I'll read it out. How are you, if at all, connected to mobile work? And you can select all that apply, and I'll give you a bit of time to answer that. So I think I'm going to continue on now and continue with the presentation, looking at methods. Okay, so that was interesting. I see that 40% of the people on the phone are mobile workers, so that's helpful. Now, in terms of methods, we have, first of all, a classic legal analysis in 6 provinces. You have the different provinces up on the screen. Classic legal analysis means understanding law, regulation, policy, and administrative tribunal case law in particular, or all case law, but we were particularly focusing on the appeal tribunals in the different jurisdictions that you have on your screen. We also did key informant interviews between 2015 and 2018. And there were 20 interviews done in 5 provinces. Many of those were group interviews. So we had 47 people in total, including regulators, representatives of employers and unions, legal counsel, not-for-profits, representing injured workers in different provinces, for instance. And we also had some regulators who preferred to answer in writing. So over and above the 47 people who participated, we have several documentary participations through written responses to our questions. In terms of the return to work study, so that's the more recent study that started in 2016, we're doing the same type of classic legal analysis specifically on return to work, which means workers' compensation, but also occupational health and safety and human rights law. And the 4 provinces involved in that study are Alberta, Newfoundland and Labrador, Quebec, and Ontario. And similarly, we did interviews with key informants, as we did in On the Move, but we also did interviews with workers in those provinces. And some of what Dana's going to be presenting comes from those interviews with the workers. So the first results slide, if you like, as if you're familiar with workers' compensation, you will know it's provincial jurisdiction and provincial and territorial jurisdiction. So there are 13 different legislative frameworks to which we add the, what we call in our language, the GECA, the Government Employees Compensation Act, which is the federal act that essentially says that if you work for the federal government, you will be governed by the provincial legislation that is in force in the place where you are injured or working, depending on the circumstances. Now, workers' compensation, as everybody perhaps knows, but just in case, is a no-fault system. A no-fault system means that if the employer is at fault and there are dangerous working conditions, that doesn't affect in any way the amount of compensation the worker receives. And if the worker is at fault, normally, except for exceptional circumstances, the compensation board is obliged to compensate the worker, even though he has been imprudent or not worked according to regulation or instructions. It's a system that is funded by employers since the beginning of the 20th century. They're old systems, and they're funded by employers because employers are protected from lawsuits by workers. And sometimes what we've been looking at in this study is that the case law shows that the employers are actually the ones trying to make sure that coverage is available to the workers because they don't want to be sued in circumstances where they would be sued if it was not a work accident. So it's not just workers appealing in these appeals we're looking at, it's also employers trying to make sure that they can't get sued. It's administered by public workers' compensation boards in all Canadian provinces. That's unlike the situation in the US where there's a lot of private insurers involved. In Quebec, in Canada, it's all public. So among the issues, and there are dozens of issues, so I'm not going to touch on all the issues, but a key issue that is really recurring throughout this presentation, the doorway or the pathway into workers' compensation is your injury must arise out of or in the course of employment or be an occupational disease. And for the moment, if it's arising out of in the course of the employment, we're looking at what we call in the jargon accidents. And then the big issues for the mobile workforce are commuting accidents covered, under what circumstances, and we'll take a look at that in a minute. Accidents while I'm a worker is on a mission for the employer, are they covered? So if I'm a researcher staying in a hotel in Vancouver because I'm going to give a talk the next day and I fall in the shower, is that compensable? If I'm on a mission in Europe, is that compensable? And how far does that compensation coverage go when I'm on a mission for the employer? Injury while in employer-provided housing is also an issue that has come out in our results as being preoccupation. The question becomes, as you'll see in a minute, if the employer provides the housing and the person falls in the shower in that housing, is that a compensable injury? So poll question number 2, do you have experience with workers' compensation related to mobile work? So I think that should give us a good answer. So about a third of you have an experience related to workers' compensation and mobile work, and that's useful to know. And now we'll get into our, this presentation just touches on some of our findings. There's quite a lot of documentation on what we found, but in terms of the challenges for regulatory effectiveness, the way we are presenting our results here and more broadly in some of the publications that are in production, we're looking at vulnerabilities that are specific to each category of the geographically mobile workforce, and then within categories. So each category, for instance, temporary foreign workers is one category of the mobile workforce, and one of the challenges that is specific to that category is the question of deportability. People, as we'll see in a minute, are afraid that if they speak up, they can be deported. The employer will send them back to where they come from, and that has an effect on worker voice. Gold collar versus blue collar mobile workers, they can be internal migrants between a province and another province or within a province. A businessman or a university professor is a gold collar worker who is flying around giving talks or investing, and when they have injuries while they're on a trip, there's quite a lot of case law relating to them. There's also a lot of case law relating to blue collar mobile workers, people who are flying into resource production areas, and the fly-in, fly-out workers, for instance, in northern Alberta. And we're finding that even though there's similar types of issues, the outcomes are not always identical. And this is something that we discuss in more detail in terms of questions that we have in relation to our policy brief that we are ready to share with stakeholders and those who are interested. In terms of workers' compensation, there's the first issue of coverage, and there's many issues in relation to coverage. Who is a worker, who's an employer? I won't go into the details now, but we will focus on a couple in a minute. There's also the issue of benefits. How do you calculate your benefits, and what are the benefits that are available, and in what way is usual practice changed if we're dealing with mobile workers? Rehabilitation and return to work policy and practice is affected by mobility, and it's something we focus in our study. And we also focus on access to justice in terms of, for example, somebody who has gone back home to Guatemala and there's an appeal at WSIAT, the appeal tribunal in Ontario. How does that work? Can they actually exercise their rights if they're no longer in the country, or if they're no longer in Alberta, they've gone back to Newfoundland? So first element in terms of coverage, one of our findings is that when we compare all the jurisdictions we were looking at and the case law within jurisdictions, we find that there are lots of fuzzy rules on coverage. And I've chosen the home care workers as an example, but I could have chosen any category of mobile workers and teased out some of these issues. So home care workers, the majority of the case law, and depending, some provinces have policy on this, others do not, but when you conjugate all of that together, the majority of the compensation boards and the appeal tribunals will say when the home care worker is leaving home to go to her first client, or leaving the last client to go home, if there's an accident on the way to or from that first client or that last client, the coverage is not available, because this is not seen to be arising out of and in course of employment. It's seen as a commuting accident. Many jurisdictions around the world cover commuting accident and workers' compensation, but no Canadian jurisdiction explicitly covers all commuting accidents related to workers traveling to and from home. So that is fairly straightforward. There are exceptions. I've seen cases that have covered in some cases, but for the most part, that's fairly straightforward. But as soon as we get looking at traveling between clients, it depends, the answer depends on the province. There's some provinces that as soon as you've seen your first client and you're driving away to see your second client, if there's an accident on that trajectory, that will be a compensable accident. In other provinces, it depends on the circumstances. In types of things that people will take into consideration in adjudicating these cases is whether the collective agreement provides for salary for these people. Sometimes it's $1 an hour for the commuting period, but that's enough to at least invest in the idea that this is a work-related activity. But there's also provinces, and I won't name specific provinces in this presentation, that depends on invisible rules. So one of the key informant interviews I had, they said, well, we will cover the supervisor who's going between clients watching the worker if the supervisor is injured, but we will not cover the worker herself. And it wasn't quite clear to me how that was justified, but what I seemed to understand was it related to the precarious nature of the contract of the home care worker herself. But it's unclear, I guess, is the short version of this slide. And when it's unclear, we have problems with responsibility, and we have problems with adversarial relations with the board that, of course, don't improve health outcomes. The second context in which there are problems in terms of coverage is the question of work camp facilities. And that, again, using the same methods, it really depends on the province on the one hand, and even within provinces, it can depend on the particular factual situations. So one thing that struck me, remember when I was talking about gold collar mobility, pretty well all the cases I saw in all the provinces, and it was true when there was policy, it was fairly clear. If a gold collar worker, and they don't of course call them gold collar worker, but if a person who's on a business trip at the bequest of the employer has an accident in the place where they're visiting, even if it's while they're having their supper by themselves without a client, that will be covered as a compensable injury arising out of in the course of employment in most cases. If they fall in the shower, as I say, it will be covered in pretty well all the cases I saw in terms of case law and policy. On the other hand, when you're looking at a similarly mobile worker, but who is a blue-collar mobile worker flying into a work camp, and maybe there's no toilet in the room in which they're in a work camp, this is rather a primitive picture, but in forestry we are seeing some cases in which it's not that much better today than it used to be. We have cases where they say, well, when the person goes out to look for a toilet, that's personal activity, not covered under workers' compensation. Whereas in other cases, it's clearly compensated. So it really depends on the province. It depends also on policy. Even between Alberta and BC policy does not require that the workers show that the work camp was a source of hazard, whereas Alberta policy, when we did our study, if the worker can show that he's a captive worker and that there was a hazard intrinsic to the work, the facility provided by the employer, then they will compensate. So the rules between each province are different, and even within a province, it depends sometimes on the adjudicators who hear the cases and appeal. In terms of challenges of interprovincial mobility as such, there are jurisdictional issues, and I could talk about this extensively, but I'm not going to at this stage. If there are questions, I'd be happy to talk about it. There's an interjurisdictional agreement between all the compensation boards, which seems to work well in many cases, but not always. And there are some provinces who have opted out of some provisions. Quebec opted out of the provision on occupational disease, for instance. But over and above that, in each legislation, there are rules about who has jurisdiction. And the question is which workers' compensation board is going to compensate. And that's an important question because the rights are different from one province to the next. And the procedures are different. Even the deadlines are different. Sometimes it's 6 months from the date of injury. Sometimes it's a year. So that it's important to know which compensation board you should be applying to. And many workers have options. Some legislation allows for you to opt between two possibilities, and the rules for options are not identical from one province to the next. So it's quite complex. If you, even as a lawyer, to be advising workers, I certainly am really, really careful where I would be careful where I do actually say anything before looking everything up. Same thing in terms of who is the employer. So this is true of subcontracting, precariously employed workers, temp agency workers, but it comes a lot, we see it in the mobility case law as well, because what happens is you can leave from one province with a crew who's going to go work in another province. You've always worked, say, in Quebec for the crew in Quebec, and then your employer for the company in Quebec sends you to Alberta. Well, is it the employer in Quebec who is your employer? Is he recognized as an employer in Alberta? How do those rules work? The boards have answers to these questions, but they're not easy questions to answer. And there's disparities between provinces again. Which exposures count in determining occupational disease claims? There's quite a lot of, well, at least a dozen cases that I've seen in the different provinces where people are exposed in several provinces. Say you're talking about musculoskeletal disorder where the person in Quebec is applying under the occupational disease legislation, and they've got exposures in 4 provinces. I've seen cases saying, well, the exposures in the other provinces, we don't count them. And therefore, we're only looking to see if the sufficient exposure in Quebec is sufficient. And that, of course, undermines compensability, even though it's clearly the work that has led to the disease in the specific case. And then other studies, a study led by Dr. Nicola Sherry, and I was part of this and very happy to do so, to be so, is about the question as to how reliable compensation board statistics are if we want to track mobile workers. And in that study, we were looking at workers who were injured in Alberta and who were from Newfoundland, and Newfoundland law made it easy because there is no option if another compensation board is can be held to compensate in a given case, and Alberta will compensate if you're injured in Alberta. So the statistics are more reliable as in that study, but you might see that if it's between Ontario and Quebec, the statistics where there are options can be a little bit more muddy. We haven't done that study, but if you're interested in numbers and statistics and the reliability of your own data, if anybody from the boards is on the phone or listening, I think that's worth reading. It just came out last month. Challenges of interprovincial mobility now, distance issues. What if the worker wants to go home while healing from the injury? No longer available for modified work, no longer available for medical exams requested by the employer or the compensation board. Those are issues that we address in detail in our reports. And what if the hazards are related to employer-provided housing in a remote workplace? To give you just one example, a woman I interviewed who worked in the far north, a healthcare worker who was held hostage in the residence provided by the employer for 8 hours, developed a psychological problem related to that was compensable. There was no doubt about that. 11 hours by plane to get back to Montreal. The question of providing light work came up. She was off for several months, several years actually, and her doctor would have supported light work if the employer agreed to put bars on the window of the residence in which she was living, and it was his residence. The employer it was their facility. And the litigation around that eventually, after several years, I think over 3 years, led to an out-of-court settlement, but the worker never went back to work to that workplace, even though bars would have sufficed to solve the problem, because neither the board nor the employer would agree as to whether that was part of the workplace that could be the object of an order to add the bars. So the issues of housing, that's just one issue, but I think you can imagine how difficult this can be in some circumstances, particularly since the employer's not there. Problems faced by international migrants now. I won't go into too many details, but the young butcher on the left comes from a case from Quebec again. He cut himself, and it was severe enough that he couldn't do light work as a butcher, and there was no other work that had been offered to him by the employer. So the board said, yes, you can go home to France to heal. As soon as he left the country, the employer litigated, said, now I do have light work. Litigated also to say that I want a second opinion on the state of his cut. The worker was back in France, and the appeal tribunal said, I'm not bound by international agreements between Quebec and France, and cut the worker's benefits off. So it creates regulatory and challenges in litigation. Of course, we think of temporary foreign workers in the agricultural sector, and we will have a special webinar on that, so I won't go into too much detail in that regard. But in terms of vulnerability, what I will say, and it's Tanya Basok's research among others, and several team members as well have done work on this, temporary foreign workers, including workers in agriculture, but not just workers in agriculture, are afraid to speak up because of the consequences of filing a claim or even of looking like they're going to complain. Lack of information, there are issues in relation to language, but even when they speak English, because of the deportability, they often will not speak up, according to the studies we've looked at and some of the interviews we've got. Medical services, they're often outside of urban centers and are dependent on the employer to get to medical services. And over and above that, some of the evidence suggests that Canadian doctors don't all know that temporary foreign workers are covered by workers' compensation. And that could really be improved if information targeting doctors could be sent out. Obstacles attributable to distance now. There are medical reports after the worker leaves. Be the worker who leaves Alberta to go to Newfoundland, or if it's a worker goes back to Guatemala. Are the local doctors considered to be reliable doctors? This is an issue that takes many faces and has been raised in many jurisdictions. And then language is also a challenge, because in Guatemala or in Quebec, if the compensation board is one of the other provinces, is there anybody there to read a French report or a Spanish report, and how does that work? Debates as to eligibility for benefits of the employer cannot get a second medical opinion have been raised in the case law, particularly in Quebec, but in other provinces as well. The boards sometimes want a second opinion, and sometimes Alberta will fly people back in for that second opinion. I haven't data on every province in relation to that. Now, calculation of benefits and deeming. This is a complex issue, and I'll try to make it simple, and I don't want to take too much time. So when we want to calculate benefits in every compensation system in Canada, the way it works is they look at how much the worker was earning at the time of the injury. And once the injury is healed, they look at how much the worker is capable of earning. And the difference between the two, they are deemed capable of earning what the worker is evaluated as being capable of earning with his residual abilities. And the compensation benefits will be the difference between the two. What happens with that is that the question is, which labor market do we look at? The short version, in this case, the Cirque du Soleil, this was an acrobat from Kazakhstan, and Quebec and every other policy I've seen in the other provinces say we look at the Quebec market, we don't look at the Kazakhstan market. So he was deemed capable of earning $28,000 a year as a shoemaker for his residual ability, when shoemakers in Kazakhstan make $2,000 a year. In Ontario, it's the only case up on the screen where they decided to take the workers' home market to evaluate that, and that's an important finding, and we are tracking to see if that's going to be followed. So now for my recommendations in terms of targets. We have a policy brief if anybody's interested. We target the 4 categories of respondents on the left, and that's provincial regulators, federal regulator, employers, and unions. We're looking at the issues we've just walked through. So jurisdictional problems, coverage, determination of benefits, modified work, rehabilitation and access to justice. And finally, and this is my concluding slide before I give thanks, the challenges and effectiveness of workers' compensation law. There's the invisibility. There are people quitting their jobs, they're not reporting, they're dropping their claims, and they disappear from statistics. Increased complexity, challenges for return to work. It's the issue I just raised about labor markets. And early return to work provisions apply with difficulty to this labor force. I don't have time to get into the details of that, but I think Dana will speak a little bit to that. When workers want to go home rather than do light work, what happens to them because they have to choose in some of these circumstances. So I want to thank our funders and On the Move, and of course SHIRC and CIHR, our funders also, for our new partnership grant. And I want to thank the organizers for this event as well. So thank you.
Okay, Dana.
Thank you. Thank you, Katherine and Barb and Yusra. As Barb and Katherine mentioned, I'm presenting today some return to work policy and practice challenges for injured mobile workers. And these challenges really emerged from a study of return to work among mobile workers, which is part of that partnership development grant that Barb and Katherine described earlier. And I'd first like to acknowledge the co-authors of this presentation, who are other team members of the Partnership Development Grant, and now the Partnership Grant, who shared with me mobility-related data from their respective studies for this analysis. So the goal of this study on injured mobile workers was to explore what happens when a worker lives in one place and then works, gets injured or sick, files for compensation, and participates in return to work in another place, oftentimes far from their home. So we really wanted to know, what does their return to work experience look like, and what might be the challenges? And so while the policies and practices that promote return to work after work injury have been studied extensively, that research is largely focused on the general working population, and factors affecting the return to work experiences of mobile workers remain poorly understood, despite, as Katherine noted, the increasingly complex and challenging mobility that many Canadians undertake for work, especially with the growth in precarious employment and the expansion of construction and transportation and other sectors such as home care and house cleaning. And so before I go on, I want to introduce a third poll here, just to get a sense for whether members of the audience have experience with return to work of mobile workers. And if so, in what capacity you would have that experience.
So we have 50% of injured workers, 25% of supervisor or human resource managers, and 25% of union representatives.
Okay, that's interesting. Okay, so you may be interested then to see what sort of emerged in some of the interviews from this research. Okay, so this presentation then is bringing together relevant findings from the 4 provincial studies undertaken in Newfoundland and Labrador, Ontario, Quebec, and Alberta as part of the developmental phase of the partnership grant. And this research, the objective of it was to explore from the perspective of injured mobile workers, the effectiveness of return to work policies and programs, and any mobility related barriers to return to work. And so for the purposes of this analysis, mobile workers are defined as those who work more than 200 kilometers from where they live. And that could include work within their home province, or they might commute to a different province for work, or could include work offshore. And this analysis is looking at domestic workers within Canada, and it's not considering the return to work experiences of internationally mobile workers, such as temporary foreign workers, who will be discussed in an upcoming webinar. This analysis involves data from a subsample of 13 workers in the 4 study provinces who spoke about mobility-related challenges during their interviews about their return to work experiences. So this data was collected via in-depth interviews with mobile workers from Newfoundland and Labrador, and with precarious workers in Ontario and Quebec, some of whom were also mobile workers. And this data was also collected via semi-structured interviews with mobile workers in Alberta. The resulting sample included 4 women and 9 men, and the sample represented a fair amount of variation in age, which ranged from 23 to 60 years. There was variation in family situations, so included in the sample were people who were single, married, divorced, and with or without children. A range of occupations were represented, including nursing, trades, manufacturing, service, and resource extraction. Mobility scenarios included fly in and fly out, as well as extended intra and inter-provincial commutes. And there was also the gamut of return to work status and workers' compensation claim status. And a review of the data from these 13 mobile workers revealed unique return to work challenges that work mobility can introduce, as well as the ways in which return to work processes can influence mobility. So in these next slides, I'll review some key challenges and provide illustrative quotes from the interviews with these 13 workers. Mobile workers described absences from work or modification to their work related to their work injury that disrupted their normal routines at work and at home. And the consequences of these disruptions seem particularly problematic for mobile workers who may depend on the consistency of their routines or their modes of travel. So for this woman, she took time away from work due to her injury, and that interrupted her usual rotation, which had coincided with her boyfriend's rotation schedule. And this resulted in long stretches of time apart. So she says, I was supposed to go on my next shift with my boyfriend, and I couldn't go. So we weren't able to see each other for a month, because after that, we were alternating shifts. Like his plane would fly out and my plane would fly in, sort of thing. And for this worker, he was sent to a different work location as part of his work accommodation. But the new location was 2 hours from where his original job was. So his employer suggested that he carpool with others who were driving to the new location. But he notes, like, I was pretty well stranded. I could get a ride there and then be told that I'd have to wait 8 hours to come home, and I'm only supposed to do 2 hours work. Related to disrupted routines is the extended travel and or time away from home for return to work requirements, such as medical appointments and treatment. In some cases, injured workers could return home, but would have to travel several hours, for instance, to an urban center to see specialists selected by the Workers' Compensation Board, or to participate in rehabilitation or retraining programs. Or in other cases, workers could not return home to recover and would have to remain in their work province for prolonged periods of time. So as you can see here in this quote, this worker in Alberta from Atlantic Canada notes, "My caseworker said he worked here, he got hurt here, he can get treated here. So I flew back and forth for treatment 5 times before the surgery." And for this worker here, he missed some critical time at home and notes, "I would have liked to have healed at home. My father died 3 months after, and I could have spent the winter with him." In addition to missing out on family time due to extended travel between stays in the work province for treatment and so on, injured workers suffer from the lack of meaningful family support when they're unwell and when they likely need it most. They spoke of feeling lonely and isolated and of having to look after themselves. So again, this worker in Alberta from Atlantic Canada says, "I didn't want to stay in a hotel alone. I wanted to be around family. My case manager was horrendous. They said we didn't have the proper medical facilities at home. They wanted to deal with their doctors." And this restaurant server from Newfoundland who was working in Nova Scotia says, "I was very much alone because I had moved from my hometown, so my parents weren't accessible. You're in a new province you've never been in before, you feel alone, isolated, and you have to make ends meet. You have to cut back." For many of the injured workers, their inability to travel meant that their family had to undertake extensive travel. So multiple workers in Alberta noted their employer flew their spouses or families to the province when they were unable to travel. Or for others, spouses traveled with or drove injured workers to appointments several hours from their home, or spent extended stays with them in the work province to support their recovery. So these first quotes come from an electrician in Newfoundland who would have to drive several hours to an urban center for appointments, and notes, "My wife would take me to all my doctor appointments, and if I ever had to go to St. John's, I would have to stay overnight." And he notes, "They sent me to St. John's for 5 weeks to another program. They paid for it all. They put me in a hotel, my wife and I." And this worker from Alberta notes, "After the surgery in Alberta, my wife came to Calgary as a caregiver for 3 weeks, and then we flew home." Finally, the injured workers note financial hardship associated with their return to work, particular financial hardship associated with that mobility as well. So this worker notes that he was from Alberta, where the board wouldn't pay for care in his home province, so he bore that cost himself so that he could go home to recover. And he says, "I got a local therapist and paid for it on my own, going through my savings, feeling guilty, paying for it myself, and taking it away from my family." And this worker noted that the struggle of his return to work process included his inability to see his kids as often as he would like, because he couldn't afford to go see them and he couldn't afford to pay for them to visit him. And he says, "I have kids that come see me on the weekends and stuff, but lately I don't encourage them to come because I can't afford to feed them, and I can't afford to go get them." So in conclusion, injured mobile workers experience unique return to work challenges. The requirements of the return to work process not only amplify impacts of work mobility, such as extended travel and time away from home, and the related difficulties, such as strained relationships and financial hardship, but it can also introduce new and different forms of mobility for workers, by example, through accepting suitable or modified work in a different location, or through travel for return to work programs and appointments. And when work injury renders mobile workers immobile, the mobility and related impacts may be shifted onto family, as in the case of the wife who flew to Calgary to be her husband's caregiver for several weeks, or the spouse who drove her husband several hours each way to appointments in St. John's. We'll be continuing to explore these challenges in the coming years under the partnership grant, and I'll be looking in particular at impacts of return to work for mobile workers' families and home lives through interviews with family members and caregivers themselves in my planned postdoctoral study with the partnership grant. So I invite you to get in touch if you have any questions or comments that may inform any of this research going forward. And I'd like to end by thanking the research participants and funders of this particular partnership grant on return to work.
Thanks, Katherine and Dana. So we have one question in already, and hopefully there'll be a few more. So the question we're being asked is, in your opinion, how can systems be improved to meet the mobile workforce needs? Which areas should be focused on and prioritized?
So, Barb, I think I'll get started with that question. This is Katherine. We have actually a policy brief that does list a certain number of recommendations, and while I won't read them all out to you, and I don't know if it's possible to get back to sharing my screen because I went over the last concluding slide very quickly, but we have a list of some of those things. What I would say is that, first of all, the acknowledgement that mobile work exists, and it's not just about temporary foreign workers, but interprovincial and intraprovincial mobile workers should be considered as well. Because once we start thinking about mobile workers, we start seeing the types of problems that could be avoidable if policy had been thought through for them. So Dana was talking about people who want to go home to heal. And one example that we had, that we developed in this policy brief is just the disparity in terms of the benefits between somebody who is compensated in Alberta and somebody who is compensated in Nova Scotia. If a Nova Scotian wants to, who is working in Alberta, wants to go home to heal, one option is to opt for having their claim managed in Nova Scotia. That's a possibility in those cases. But there's no maximum insurable earnings in Alberta, whereas in Nova Scotia, they're quite low, the maximum insurable earnings. So a high wage earner, somebody making more than $100,000 a year in Alberta, would take a big cut in benefits if they decided to go home as such. Furthermore, if they decided to claim in Alberta and then they went home, they're in a position where they have to go, they could be penalized for not taking up early and safe return to work proposed by the employer. And some of the examples we had, somebody who would be on rotation 2 weeks in Alberta, 2 weeks home, the light work could be 2 hours a day every day, but no more rotation work while the person was healing. So in terms of the therapeutic aspects of staying in employer provided housing and work camps and never going home until you're better, that is for some people not really an option, so they would quit. Or they would, if not quit their job, they would drop their claims or say, whatever happens to my claim, I want to go home. That leads to under evaluation of the extent to which workers are being harmed. And at the same time, you understand the employers, because the employers are being experience rated, and if benefits are being paid and they're higher because the person's gone home, the employer is being penalized. So one of the recommendations we have is to adapt policy for the mobile workforce, particularly in terms of interprovincial and international, to allow people to go home and to make sure that the experience rating rules are adapted to not penalize the employer who tolerates that the person go home. That would be one example. And one thing that came out of our study was that a lot of the people who are working flying in and flying out are working for subcontractors, and it's expected that the primary contractor, the company that is providing the work, when they subcontract, they want healthy workers supplied by the subcontractor. So it becomes quite difficult for the subcontractor employer to provide light work for those workers as well. So having an adapted return to work policy that doesn't penalize either the workers or the employers, and that at the same time allows for mobile work to continue with the protections and the application of the law, would go a long way in helping these workers and helping the employers who are using their workforce, or the subcontractors who are hiring these people. That's one example.
Thanks, Katherine. We have a second question. The second question is, if there is one message to retain from today's webinar and for our audience to take home or to work, what would it be?
I would say it would be that you should be familiar with the existence of the different categories of mobile workers, and you should think about their needs, be a union or a manager or a workers' compensation board or a worker involved in this. What is special in terms of work injury, return to work for this workforce, and how can we adapt our practices to better meet the needs of the workers and the employers?
Dana?
Yeah, I would add as well, just to consider around the impacts of particular policies and practices on the worker's life beyond that return to work process. Certainly what came out of the interviews was considerable impacts on families and home lives and so on, and you know, making sure that the policies take into account how families is impacted as well.
Yeah, so the wife who has to drive her injured husband various places, a lot of the interprovincial and mobile workers are men, may also be employed herself.
Exactly, and how can we, you know, all of these informal supports and so on, making sure we're accounting for all of those other people that are being pulled into the return to work process.
And the third question, are you aware of any strategies to overcome barriers related to workers' compensation coverage or the determination of benefits?
So I'm going to, this is Katherine again, I'm going to interpret this question as being specific to the mobile workforce. And I would say that the strategies that I've seen that are perhaps the most effective if workers are unionized is to have language in the collective agreement that shows that travel is part of the work, so that the hazards associated with that travel are taken into consideration in the conversations both with workers' compensation boards and we'll see in the July seminar in terms of occupational health and safety. So collective agreements can go a long way to recognize, even though the workers aren't necessarily going to be paid their regular wage for the travel, if it's acknowledged that this is travel that is required by the work and that there is therefore social protection available to the workers because it's easier to make the case that an accident arises out of and in the course of employment if the collective agreement has already made the link. It's not guaranteed, but it helps. So if I had to pick one strategy for the mobile workforce, I think that would be it. But there's many we could go on for hours.
Okay. I think that's our last question. Dana or Katherine, are there any last minute reflections you'd like to add before we go back to you, sir?
I guess I would just add on to what Katherine's answer to that final question, and I will ask you to jump in, Katherine. I don't know if this is a strategy that exists. You mentioned that workers can choose, in some cases can opt which board for which they would be compensated, where that's a possibility, but it's been mentioned to me in conversations with some key informants that would work really nicely as if boards spoke to each other, even just around arranging retraining opportunities or healthcare possibilities in the home province. If the compensating board and the board in the home province, if there was some mechanism there where they could communicate to come up with those arrangements. And I don't know if you're aware of anything like that exists, but certainly some key informants have indicated that that might work nicely or be helpful.
Yeah, well, first of all, there is an interjurisdictional agreement, and there are human beings working for each board who are specialized in that agreement and who talk to each other on a regular basis. And, from what I see, have been doing as well as they can in light of, first of all, courts will come out with a judgment and then they have to sort of try to figure out how to adapt that to the understanding. So there is, one of our recommendations is to look towards the interjurisdictional agreement to see how it can be bolstered, how we can get better language in relation to occupational disease, so that the boards do talk to each other. I know that the individuals do talk to each other, but the question as to whether you can be a board in one province and the claim is managed in your province where the accident took place, and the worker wants to go home in another province, and that you continue having a dialogue. What did come out of our study was that the compensating province will not delegate bits and pieces to the local province, as far as I understand. I haven't done all the permutations and combinations between all the 6 jurisdictions. But certainly I think, Dana, that that's a good idea to see how we can make it more seamless, because the treatment of interprovincial workers and international workers, and to a certain extent internal migrants within a province, are not as seamless and fair and effective as the way workers are treated when they're living not very far from their workplace. And I think it's an equity issue that we can try and do better in relation to that.
Okay, I think it's back to you, Yusra.
Katherine and Dana, thank you so much for this compelling and extremely informative presentation. Barb, thank you for moderating the webinar and for the efforts put into coordinating the health and the mobile workforce webinar series. I would also like to thank our attendees for their interest and their participation. Thank you all for sharing your valuable time with us.